Hi, I'm gonna be talking about the advocacy, the public policy, the support group, and the conclusion. Patient advocates are always available to help support the patient. The family members are always encouraged to contribute in the care. Healthcare professionals that are the people that determine when a treatment can be given appropriately. And these people include the speech therapists, the occupational therapists, the case management people, the nursing and wound care, the social work services, the respiratory care, and the physical therapists. The public policy. The American Lung Association of Oregon State is a strong voice on importance of local and state issues. This issue related to lung health topics. They develop the legislative priorities through a collaborative process involving the ALAO board of directors, the program staff, the community partners, and the suggestion of the ALO membership statewide. Support group may be needed at any time. This is because patients may have trouble speaking, may be thirsty, have pain, trouble sleeping, or not feeling independent of themselves. So it's always there to have a support group in order to help when needed. The Better Group Club Association, this combines of the educating patients on the kind of sharing information and letting them know how to have the opportunity in social life. And these people are the Americans Breeders Club. And they also have education program which include the video, the literature, where they demonstrate and present by guest physicians on the respiratory therapists and other healthcare and social welfare professionals. They are also an international organization that deal on the ventilator network, that people can go to the website and chat with people and have the opportunity to chat with the healthcare professionals and talk about the equipment and aids needed for them to cope with their breathing problems. Then the group do have their 47th annual chest disease conference that based on how to breathe well. They kind of encourage the survivors to have the opportunity to come out and learn how they can breathe well and live well and facilitate their training. And there is an address for them if you need a contact for them, or their website is always available for you. They also have a training where they encourage people to spend like 6.5 hours for them to help breathe well, and they encourage people to come and learn how to breathe on their own. In conclusion, patients having breathing distresses utilizes artificial ventilation for airway support. Although there are different kinds of ventilation and the standard of care is different. Daily, a lot of ventilations are introducing, and depends on the kind patient need, varies from one patient to the other. For instance, the kind of one I'll be ordered to use might be different from the other one you can use. Also, people like young people having breathing problem, at times they might be having some issues on how to express their feelings if their family members are not there to help them facilitate their needs. Like at times their language, some people might have a first language, then communication kind of become a barrier for them. Also, culture might be different from how we perceive from theirs. Sometimes they might stay more than required in the hospital due to some barrier issues that need to be taken care of. That's why we nurses, we need to be realistic to our patients and try to listen and pay attention on our patients' need. Although some people might have some difficulties in expressing themselves, we are kind of an advocate in order to help them at all time. Healthcare professionals kind of incorporate in the most of ventilation and treatment protocols. And this will help the patients to have a desired outcome from the treatment, and all our goal as professionals is for our patients to come out from the mechanical ventilator and breathe on their own. And that's our main goal. Also, if there is any problem in weaning from the ventilator, it is always important to recognize that mechanical ventilator is not a treatment. Rather, it is a means to support our patients in order to have a gas exchange until the underlying conditions are being resolved. In some percentage of patients, the underlying conditions is irreversible. Also, once it is determined that a patient is ventilator dependent, plans should begin as soon as possible. The process of discontinuing ventilator support should begin as soon as the patient is committed to a ventilator. Lastly, and not the least, always remember that transition begins as soon as possible in order to minimize the risks of further injury to the lungs, and our patient will come out without any problems. Thank you.